this problem. What problem is like I said, day to day, the last 3 decades I transformed itself saying, you are doing everything not the body to not the soul so I think if they are rightly, you can say, they could become global health care. But the government wants to call it rightly so, saying that India also has this natural yoga, meditation. If you add these two, you call it heal in India. Heal in India is good for people. Not only beautiful for us, I think it's some gift that we will give it to the rest of the world. So help in the mantra, as I call it, for individual, mantra for the nation, for the health, healthier and happier and wealthier nation. And it's a mantra for the world. We will give it to the world. We're going to start it very soon. It's already started all over the world. Very soon, we'll take it to the world. We will make a significant impact. And those who should have an intention to say, I need to stay back. I need to be a responsible member of my family. I need to keep my family happy. I need my contribution to the nation. I think these three are driving factors. Primitive health should take everybody's attention. And as I used the word say, not in the investment, it is not it is an investment, not an expense. Go ahead, not an investment, not a go ahead with the mantra of good health. God bless all of you. I hope the nation and the world will follow. Keep individual saying, I must care for my health. Because I am important for my family. My family is important for them. So I must look after their health. I think it's nature that the nation and the world will be healthier, happier, and happier. Of course, the $30 trillion will not go for it. But that's all. So, it's a wonderful study done, and we assure you will follow. The authors are very interesting article where I can see saying, I can see launches new health initiative aiming to add years to life and life to years. I think it's a wonderful thing. Everybody take this up, stay healthy, stay happy, and have a wonderful time.
Thank you. Thank you, sir, for your insights, for that impassioned clarion call for good health. As you rightly said, health is an investment, and every nation is probably as rich as its health. With that, we now open to answer all of your questions. Please do put your questions into our chat box, or if you'd like to ask them, you can just raise your hand, identify yourself, your application or organization, and also to whom you're directing your question. May I request Mr. E. Kumar Sharma to please unmute himself and ask the question.
Hi, thank you very much for the opportunity. Two quick questions really, but just at the risk of repeating also, just 3 factoids. If we can just, for the sake of perhaps even at the risk of repeating, just the sample size, the time period when the study was done, and also the broad number, which is, let's say, 60% of deaths due to NCDs has been a case for a very long time. So what's the current number like? And my 2 questions are, in the last 2 years of the pandemic, what has the study shown in terms of what has been the major impact on NCDs in the pandemic months? And today, now that the pandemic fear is slowed down, how are the footfalls when it comes to patients with NCDs?
Thank you, Mr. Sharma. Dr. Saboo?
Thank you, Mr. Sharma. In terms of data, I think I'm going to request Satya to come in with the data, but I'll answer the question. Sharma, great points you make about NCD. So clearly what we saw that People were worried about their life, so there was no question about getting the preventive health checks done. Also, they were not exercising, they weren't moving out. So, as Chairman Dr. Reddy alluded to, it was bound to happen that the numbers were going to increase with NCDs. So, that's what we saw. There was clearly what we saw was patients who needed a particular intervention coming much later, sometimes several months later, and that had a detrimental impact on their overall health. Glycosylated hemoglobins were all over the place. Those with renal failure due to diabetes, their creatinine was way higher, and we could manage it a bit better. And it was really the circumstances around the pandemic and also the fear psychosis that had developed. So elective work came down, and now we are seeing that people are coming back. People who had knee pain for say 2 or 3 years, that has been very difficult on them, are now getting their knee replacements done. We are getting patients focusing on their elective procedures that needed to be done. So we are seeing this number come back. And just give you one data point, we perform more solid organ transplants than any other program in the world. We're consistently doing more than 1,200 solid organ transplants every year since 2013. So during the peak of the pandemic, which was, we did 880 transplants, going down, so much less than 1,200. This year, we've ended this financial year at 1,204. So we've gone from 800 to 1,204. Of course, there is a lot more to be done because the need is just so much. So that kind of answers that it went down and it's coming up again. Satya, you want to talk about the sample size?
Yes. So the sample size ranged from about 20,000 all the way to 380,000, depending on the particular analysis that was done, because they were taken from different cohorts. And the study period itself was mostly in 2021 and some in 2020.
Thank you, any follow-up?
Yeah. Just footnote actually to this, because Dr. Reddy mentioned this as a tsunami. I just wanted to know, during the pandemic months, how high did the tide rise? And what was the number, exponential rise seen during the pandemic months, or was it like the normal trend? If there's anything that your numbers suggest on that, that's my last question.
I don't think we could actually give you a precise number in terms of, because the attention was so focused on managing COVID at that point in time. So we couldn't give you a precise number. But I think Chairman wanted to say something.
I would say if the comorbidity has increased the mortality, significant increase in the mortality for people who are comorbidity. That is the point that sort of.
Thank you so much.
Thank you, Mr. Sharma. Any other questions that you would like to address to the panel? It's an open house. Yes, Mr. Vasant, please go.
Hi, this is Vasant from the Hindu. Thank you for all the insights that you provided through the data. I had one particular question about the data that was presented. Of course, with respect to diabetes and hypertension, Dr. Sibal pointed out that the findings of the Apollo study was in line with the NFHS trend as well. But what was particularly alarming was the prevalence in the corporate sector. So, in which, if my understanding is right, the sample size was around 34,000. So, my question was that is it possible that we are sort of reading too much into it, because the person who came in for the health checkup, it is possible that they already had some predisposing factors or they were afraid about their health. So there is a sort of a bias here. Is it possible? Can we extrapolate this finding to a general population in the corporate sector? Thank you.
Thank you.
I'll make one point and then hand it back to Satya or Anupam, and that is, this is of course, Vasant, a great question. But where we have a far greater database of individuals who have done the health checkups year on year, which is averaging now about 700,000. And I must add that our chairman and our board literally, created a very special incentive. So now we have the data of almost 100,000 Apollo family members with this. But the point is, the data used for this analysis was not one-off individuals who came from a company, but wherever the corporate gave us the entire company for their checkup. So this was normalized for healthy and unhealthy. But that was a great question from you. We debated it and then created the cohort appropriately. So only companies where the entire company or the entire, three tiers of the company. So there is no negative selection or bias in this data.
That explains it clearly. Thank you so much.
Anything further to add, Dr. Subal?
I think a very, what should I say, pointed question and a great response. So nothing more to add.
Thank you. Thank you, Mr. Vasan. Any other questions? We are happy to take them. Right, so I have a question from Pratibha Raju on the chat box here from DT Health World. And the question is to Chairman and to Ms. Sangeeta. The World Health theme for this year is Our Planet, Our Health. I would like to know how climate change is affecting our health, how rising temperatures are leading to outbreak of infectious diseases, and how can we combat these, and what are some of the lessons learned from the pandemic, more specifically, not relating to climate change, but more specifically to the pandemic.
Okay.
So, thank you, Pratibha. I think it's a very important question, and all of us need to be continuously aware of the impact of the environment. The first data point, I think, is well documented that there are approximately 4.2 million deaths every year as a result of exposure to the outdoor environment of air pollution. And that's only a single point of the changing environment. If you look at the noise pollution, additional stress related to that, stress leading to hypertension, there's another factor which hasn't been well documented, but is very well acknowledged as a significant one. In terms of rising temperatures and the effect on microbial growth, that is another thing. While it's well documented again that significant heat leads to death of some of the microbes, heat as well as moisture rather than cold can lead to growth of some bacteria, and that's why you see certain disease coming up in certain seasons. So overall, I think it's important to build immunity, to stay in a state of good health, to remove all factors of comorbidity so that the body's natural immune system can combat the changing environment. And that's our health lens on it. Our humanitarian lens on it is that we need to work towards a better environment as well.
Thank you, ma'am. Since there are no further questions and we're at the top of the hour, we'd like to draw this press meet. Dr. Subal, you had
I just wanted to make an appeal to everyone, all our colleagues from the media. If you haven't had your health check, please get it done. We'd be delighted to facilitate a health check. You owe it to yourself. You keep the community at large abreast with what is happening in the world, and you don't find time, just like doctors and nurses do, to think about your health. And whenever I talk to journalist friends, they always say that, your deadlines are crazy, you're filing articles till late at night, you work 7 days a week just like us. So please make time. And if you haven't done it, please get your medical done. Do it for yourself, do it for your spouse, do it for your kids, do it for your parents, do it for everyone. You are a very important pillar of our society, and I think your health is crucial. So just
adding one more point to this is really, I think that during the pandemic, the media also did an amazing job. We saw them out in the open, going to sites where many people were locked in at home. So congratulations. I don't know, how much you're acknowledged, but we have seen you and we truly appreciate what you've done. Thank you and namaste.
Thank you, ma'am. Thank you, Dr. Subal. And yes, Pratibha, we will be sending a copy of the study. It will be in the inbox shortly. And with that, I'd like to thank all the members of the press corps for being here this afternoon as we deliberated upon issues around health and the Health Foundation. Many thanks also to Dr. Reddy, Sangeeta ma'am, Dr. Subal, Joy.
I have one last request. Please don't stay silent about the silent epidemic. Non-communicable disease is the silent epidemic. Please don't stay silent about it. Thank you.
on that note of not staying silent, may I thank everybody for being here. My special thanks to the panelists. Thank you and have a good evening.
Thank you.